Thank you. Thank you, Linda. So, ladies and gentlemen and distinguished guests, such as e-patient Dave, on behalf of our entire RL Solutions team, I'd like to start by expressing our gratitude for the privilege of supporting MITSS through the sponsorship of this Hope Award. Our company came from extremely humble beginnings, and it's been one of our founding goals to support the champions in our community, such as Linda and her entire team, who work tirelessly for the betterment of our healthcare system. We're sincerely grateful to be here and hope, which is to honor outstanding people everywhere. Day-to-day, RL Solutions does play a small but important role in patient safety. We build software that helps our clients learn from patient safety experiences. But as e-patient Dave already pointed out, technology itself cannot drive the evolution needed in our healthcare system. But our role is important, if for no other reason than the fact that we support the work of the many dedicated and talented people that work already within our healthcare system, who can inspire those changes and are committed to doing so. Our clients bring meaning to our work and give us hope. And many of them are here today, and I'd like to thank them for their never-ending efforts to keep patients from harm. And every so often, someone comes along that's a true inspiration to us all. If a certain elegant man hadn't written the book, I would have thought that Eileen Karina held the copyright on the phrase, "the audacity of hope." After losing her first son due to complications from a routine tonsillectomy, she has all but dedicated her life to advocating for patients. And she's turned her personal tragedy into action. Her third son was a further inspiration to Eileen. Born at 23 weeks, just 1 pound 7 ounces, he could not possibly have had a better advocate for his life than his mother. Other than a few scars from tubes and central lines, he's a perfectly healthy young man today. Since then, thousands of others have undoubtedly had their healthcare experiences enhanced through Eileen's efforts. She embodies the mission of MITSS, which we've read and heard many times today. Her accomplishments are vast and numerous, and I apologize, I'm going to list them, but she totally deserves this. And she's too humble to do it herself. She founded Pulse of New York in recognition of growing need for the support services of patients and families who've experienced medical errors and other adverse outcomes. And soon after, she co-founded Pulse of America, which is a national umbrella group for independent state chapters that use Pulse concepts. She's one of the first advocates in the nation to understand the importance of working within the healthcare system. And she recognized early, as e-patient Dave also has, the importance of patients working as partners with their providers. She's the first consumer member of the National Patient Safety Foundation Board of Directors. She's the first consumer advocate board member of the Joint Commission, and still serves on many committees, including the Patient and Family Advisory Group of Joint Commission International. She's produced and directed numerous videos and audio productions for patient safety education, and she's appeared on national television and radio news. Her work has been published in major healthcare journals, and she's traveled and lectured extensively. She's a 2010 graduate of the prestigious American Hospital Association Patient Safety Leadership Fellowship and the first Long Islander to receive this honor. She was selected as one of modern healthcare's 100 most powerful people in healthcare in 2009. She's tireless and a committed advocate for patients and families. I was especially touched by reading Eileen's story that has made her who she is today. I encourage everyone to read it on our website at patientsafetyconsultants.com. Ladies and gentlemen, it's my humble honor to invite Eileen Karina to the stage to accept this year's Hope Award and say a few words.
Thank you. Yes, I am embarrassed. Thank you very much. When Linda called me about winning this award, my first thought was, why in the world would somebody want to take so much time from their own organization to honor somebody else's work? And I realized that it's really what Linda does for everybody and what MITSS does. And I think that that's really a testimony to the character of the people of MITSS and the organization itself, and the support that they have done for so many people. I actually was going to tell my story here, but when she told me that there was a check that's attached to this award, I thought, what organization would actually put their money where their mouth is? And I cannot thank you enough, RL Systems, for supporting our work. And all I had to do was show up for a dinner. I mean, I write grants all the time that get turned down, and this is just exciting. But I will tell you, most of the people in this room, I'm sure, believe that patient safety movement started with the Institute of Medicine report that came out in the late 90s, 1999, I believe, that said that 98,000 people a year die in hospitals from preventable medical errors. And my work started much earlier than that, even before the report. It started when I brought my son in for a tonsillectomy. And after he was bleeding for about a week, and I brought him to numerous doctors and into hospitals, and everyone said, don't worry, he'll be fine. He died 8 days later from that tonsillectomy. And I was angry at the system, I was angry at the people. I couldn't believe that nobody would talk to me. Nobody seemed to care. The doctors wouldn't listen. How could they see what went wrong or know what went wrong if they weren't going to talk to the mother that was there all the time? And I realized that I had to get into action. And then when my other son was born, and he was born so premature, I spent 5 months at his bedside and watched what I called the miracle of medicine. I was his advocate, and I watched the nurses and residents and doctors and everyone in the hospital system work really hard to save his life. He came home and spent 3 years with nursing care, and he is a perfectly healthy 16-year-old today. And I realized that I saw the worst of healthcare, and I also saw the best of healthcare. And a few years later, I showed up at the National Patient Safety Foundation, their second annual conference, and saw healthcare professionals talk about the problems in healthcare that they were calling patient safety and medical errors. And when I spoke up, instead of them turning me away and ignoring what I had to say, they welcomed me in. And I spent the next years, all these years, working in patient safety to make sure no other mother would be alone in the healthcare system, that no one would ever tell a mother not to worry because that's their job, and that no one would ever tell somebody, go get a second opinion, but instead we'll tell patients, we'll tell our community, our friends and neighbors, I'll help you find another doctor. We won't tell people, go find out what's the matter and go research your disease. We'll tell people, I'll help you to research your diagnosis. And no one will ever say to somebody, you better go to the hospital and bring your list of medications and bring your list of allergies, but instead we'll say, I'll help you do it, or I'll do it for you. We need a society of people who will be patient safety advocates and work together. On Monday, we started our first patient safety advocacy training school on Long Island. It's been a dream for a really long time because we're teaching community to work with community and patient safety, to teach what you already know about patient safety to the community, so we really can work as partners. So years ago, I will tell you that nobody listened and nobody wanted to hear, but they hear me now, and I thank you for that. Thank you.
Absolutely.